And a spike in COVID cases in Missouri has prompted the feds to send in teams to help. The state leads the nation with the most new cases per capita over the last 2 weeks. Statewide, hospitalizations rose to more than 1,000 earlier this week, up by nearly 60% from the month earlier. And it is even worse in southwest Missouri, where hospitalizations there, as you can see, rose by nearly 124%. Joining us now is Fire Chief David Pennington. He is of the Springfield, Missouri Department. Chief, we appreciate your time tonight. Your state certainly in the spotlight as COVID cases rise.
Yeah, thank you for having me. Certainly not a reason we would like to be in the national news this evening.
I understand that. So I'd like to share with folks at home a tweet that you posted on Twitter earlier this week. You said, "This is a mass casualty event happening in slow motion. EMS resources are depleted and the hospital systems are overwhelmed. Our community is in crisis." Share with us, Chief, what you are seeing and experiencing right now.
Yeah, certainly, just like the statistics you've mentioned previously, our community is seeing a significant and very startling rise in COVID infection, traced largely back to the Delta variant. And certainly, we know those who are not receiving the vaccinations are those who are most at risk. And that's what we're seeing inundating our emergency rooms and putting pressure on our emergency services to continue to provide care. That's resulting in transfers to area hospitals, some as far away as 300 miles, in order to provide appropriate care as the hospital systems react as quickly as they are able to bring in additional staff and resources to address the variant in the rise in infection.
There has been some conflicting information, Chief, on the ventilator situation right now in your state. I'd like to play a soundbite from the governor, Mike Parson, and then get your thoughts.
Oh, I think we did everything possible in this state we do. Number one, there should be no shortage of ventilators. Anybody saying there's a shortage of ventilators is wrong. You know, the state has a stockpile of ventilators sitting over there. So when somebody says we're out of ventilators, that's more, I would say, a management problem than anything. And then plus, it's not just the ventilators for COVID-19 patients, that's for all patients. I think it's important to make sure you know the difference in those two, you know, of really who's asking for those ventilators.
So the governor there saying not having a ventilator issue. What are you seeing in terms of ventilators? Do you have enough?
Yeah, I think that we're doing okay. Governor Parson's a good man. I think he's addressing one piece of the issue. Certainly, I want to emphasize COVID and COVID response is not a partisan or political issue. This is about providing care to our patients who are in need. Mercy and Cox Health hospitals are reacting very quickly. They have the resources that they need and certainly are requesting more as they're required. So at that, I think I'll leave it at that.
All right. The federal government, as I mentioned earlier, did deploy a COVID-19 surge team to Southwest Missouri, other parts of your state. Is that helping, and what are they doing?
Yeah, they're assisting our local health department go door to door and interact with those who may be in need of a COVID vaccine. They work very similarly to our health department's community health advocates who have been in place for many years and have been very effective for other issues in our community. So this is not a point for concern or alarm. This is a tactic that's used quite frequently to provide necessary contact for those who may not be venturing out or may need the vaccine, who may not otherwise have that opportunity.
Chief, you hit on this just a moment ago, but we know the vaccination rate in Missouri, 45%. That is below the national average of 55%. Branson, for example, south of you in Springfield, the rate is 29%. What's the attitude right now towards the vaccines, and what's being done to make sure people have access?
Yeah, I think, you know, we see a lot of hesitancies for one reason or another. Certainly individuals' positions or views on the vaccine are their own. Certainly, I'll emphasize again that this is not a partisan or political issue. There's no agenda in the vaccine. It's provided to prevent you from becoming sick. This is a virus. It's doing what viruses do. It spreads and replicates. And so the vaccine is safe. It is there strictly to provide you precautions and prevention from becoming gravely ill. Certainly, we're seeing a lot of support in the community with continuing to provide vaccine. We have made it available readily in many forms and many locations. The Springfield Fire Department continues to go out into the community and set up pop-up vaccine clinics with our partners in IFF Local 152 and the health department, I would argue that we have vaccine available. We need those who are concerned, who are unvaccinated, who are watching the Delta variant grow and spread, to listen to those who know and who can provide you unbiased information about what the vaccine can do for you, and more importantly, what it is not. Reach out, the information is available, and the vaccine is readily available should you choose to do so.
Well, Chief, we know you're doing your job along with all of those that you work with to make sure that your community is safe and that the word gets out. So we appreciate you taking the time to talk to us tonight.
I appreciate you very much. Thank you.
Maybe that's somebody calling to get the vaccine right now. All right, Chief, we'll see you later.